One more is
yes. So Dr. Jadhav says about top 3 to 5 skills on a public health graduate should have at the first place to have an edge over others.
Yes.
First one, you are in public health, it's an edge over anybody else. No other fraternity. You can say it's my bias to my fraternity, but I feel no other fraternity provides the kind of learning than it does. An opportunity to work at different levels. You have to capitalize on that. And certainly your question is correct. You need to have certain unique skills. There are many that comes to my mind. Competencies, as we call, as a mix of skill, ability, and knowledge. So we need to have communication. As I've been repeatedly saying, communication is a very important competency that we need to possess. It is practiced. The best orators in the world, including Dr. Chopra, are the most well-rehearsed speakers. So be assured on that. So communication is the first one. The second that I would say, and I tried to reflect onto it actually, was the flexibility and adaptability. I gave an example when I said that I was actually under the tree in one day and visiting with the politicians on the other day on a decision-making table in a 5-star hotel. So that flexibility and adaptability is very important. I might need to go to the rural area. I might need to work in 5 years in some setting. I worked in North Korea for 5 years. I can have a separate session with many of you or some of you if you're interested, because these are important aspects. To me, competency of flexibility and adaptability is very, very critical. Third, I would say, not in any order, as I said, is your ability to relate with, people, the interpersonal relationships, the networking is critical, because that makes and break things and makes and breaks your entry into a particular field, into a particular domain is very, very important skill. The fourth one, Dr. Jadhav, I could say is the competency of being analytical and using that analysis for the right purpose, like say for advocacy. I think that ability, that skill, that competency is very, very critical because that would give you an edge that you could, if there is a discussion with a high level technical team and you could analyze and decipher and interpret a key message and are able to then use it for an advocacy, for a policy reform. I always call and give an example of my experience of maternal death review that we introduced in Tamil Nadu that led to many reforms. And I gave that as review to reforms because we could analyze through that review some very important aspect that led to a whole reform of administration and human resources in Tamil Nadu. So that is a very important competency that we need to have. I don't know whether that's a competency or not, but the one important thing I always feel links with what Dr. Chopra said as well, which is self-belief, self-confidence, and passion. Just build on to that as a competency and you will have an edge with fellow public health colleagues, but also, with any of the fraternity. Because the rest of the things, you would have to be a multitasker. You would have to be looking into planning. You would have to be, giving attention to detail. All of those would come naturally. But to me, these, 4 or 5 are the ones which you are able to harness. You would have all of them, just harness them. That would actually make things, much easier. And the last but not the least would be for me, in the growing time, 2 that I would mention as a passing one, but they're very critical and important. One is actually the IT skills. In today's world, without the IT competencies, we just cannot survive. So one is the IT skills. And the last one is, again, an aptitude and attitude is for problem solving. I think we as public health practitioners need to focus on solutions after we have identified problem. What happens is we always identify problem and leave it. if you really want to be a successful practitioner, make sure that you have the aptitude and attitude to try and make the problem solving the solution. Sometimes it will be there, many times it may not be there. There is nothing, no mistakes, there is always learning. And with the right intent, if we are doing that, that would always pay dividend. Sometimes it is very important to learn what we will not be doing or what should not be done. And those lessons are very important, and COVID had told us and given us those huge lessons. So that's why I'm saying problem solving as one of the very, very important competency that we as public health practitioners need to have in us. I think I will just say that 5 or 6 probably would suffice. And there are, of course, many more that one would have to have, and you would have them already.